Dr. Stephen Storage.
Everything comes from the brain. All of our emotions, all of our thoughts, our goals, our impulses, our behaviors.
Dr. Stephen Storage is a child, adolescent, and adult psychiatrist, and he is part of Amen clinics who go beyond traditional psychiatry.
He is on a mission to change the world's perception of mental health by studying the brain to find the root cause of disease rather than just treating symptoms.
The 3 pillars of brain health: sleep, exercise, and
Where they've said that they do have ADHD, and they've actually described it as their superpower.
sugar was more addictive than cocaine.
That's insane.
The more we talk, the more I think you should come in for a scan. One of the reasons that ADHD is on the rise is technology in this post-pandemic world, where people have been on their screens a whole lot more.
With CTE, who are the biggest risk groups for that?
Let's say you've hit the front of your head.
What would you suggest, is the sort of easiest steps that they could do today?
5 things. Number 1,
Guys, this is a brand new podcast, and the goal is to interview the most iconic figures in sport and health from around the world. But I need to ask you guys a big favor to please like and subscribe, because it would make a huge difference to the size of this podcast, and ultimately, the bigger the podcast gets, the bigger the guests. Enjoy this episode.
Right. Dr. Stephen Storage, thanks for coming on.
thanks for having me. Pleasure to be here.
What mission are you on in your career?
I am on a mission to help people understand that mental health is brain health, and that ultimately, if we can get the health of our brain right, usually we're going to feel a whole lot better mentally and emotionally.
And who are you, and what sort of led you onto this path of the brain and mental health and psychiatry?
Great question. I'm going to try to not get too philosophical about who I am, but I'm a psychiatrist, a child, adolescent, and adult psychiatrist. I went through the traditional training that you do in psychiatry. I went to Berkeley for undergrad, UCLA for medical school, Stanford for residency, and then USC for my fellowship. And I worked as a professor of psychiatry for about 5 years, seeing patients in that model. And although I enjoyed my work, I felt really dissatisfied by it, because the traditional model of psychiatry is someone comes in, they tell you their symptoms, you check off boxes to see what criteria they may meet for a particular diagnosis, and then you think about which medication would be the best fit for them. And psychiatrists often pride themselves on being able to choose the right medicine, for the right situation. But that's the main tool, that's the main tool in psychiatry. And that, there are exceptions, obviously. There are some psychiatrists out there who are thinking a little bit more outside the box. But psychiatry as a whole, as an industry, is good enough that it survives, but not good enough for us to feel like we're really helping people on a deeper level. And so coincidentally, I crossed paths with Dr. Amen, who very much shares the same philosophy as me. We were doing a research project together, a research project using neuroimaging SPECT to differentiate pediatric bipolar versus pediatric ADHD. And we hit it off. I ended up joining Amen Clinics 3 years ago. And our work is very much in line with what I've been after, which is, let's actually take a look at the brain. We know that everything comes from the brain. All of our emotions, all of our thoughts, our goals, our impulses, our behaviors, it's all driven by our brain. And why is it that in psychiatry, we're the only medical profession that doesn't look at the organ that we're treating? If you went to a cardiologist and said, I have some chest pain, and then they said, okay, here's your medicine, without even listening to your heart or doing an EKG or an echo, you'd be like, I'm out of here. I'm not this guy. Like, what? And so our model is, let's look at the brain. let's also understand people on a really deep level. Let's give time. So we spend about 2 hours of face-to-face time during the initial evaluation. And prior to
Wow.
that, people
Yeah.
have completed lots of paperwork. They've had an interview with one of our patient historians. They've done the scans. They've done computer testing. So we really go deep. And ultimately, it's reflected in the patient outcomes. People do better when you actually focus on what's the root cause, as opposed to just thinking about which pill to prescribe.
Amazing. Yeah. Wow. I think it's very interesting that it didn't really cross my mind before that, the fact that not looking at the brain, not looking at if you went to a heart surgeon and they didn't do a scan or something, you think like, what is this guy? What are they doing?
Yeah,
You know?
because then it becomes like, trust me, bro.
Yeah.
I'm pretty sure I know what's going on. Here you go, but, and maybe 70, 80% of the time they might be right, which is good. But what about for the 20 to 30% of people where things are not right?
Mhm.
I'll tell you, I've seen scans for people who come in with a report of, let's say, depression. And you can have two people who have depression who have completely different scans. And so your approach is going to be very different for those two people. So you can have some people who come in with a classic finding of a very, very overactive thalamus, which is a deep structure in the brain. And that's one type of depression. But then I've seen people who come in with depression and you look at their scan and it's toxic appearing, right? It's full of pockets of reduced blood flow and activity. And that's someone where you're thinking more about metabolic causes, toxic exposures, inflammation. And the approach is radically different. Similar with things like ADHD. We've described 7 different types of ADHD, all of which have a slightly different way of approaching it. This is why some people, you give them a stimulant medication and they do great. They feel like it's an overnight change and they finally can think clearly. And others, they get a stimulant medication and they feel revved up, anxious, tense, and like they're on, methamphetamine or something. It's different types of ADHD, and you don't know that until you actually look at the brain.
It's interesting, yeah, with the ADHD, because I've had a couple of interviews recently, and with athletes, and where they've said that they do have ADHD, and they've actually described it as their superpower, which I thought was an interesting way to look at it.
Oh, but that's so true. It is so true. On my Instagram account, most of what I talk about is ADHD related. And the name ADHD is unfortunate, right? The attention deficit hyperactivity disorder. It makes it sound like something you definitely wouldn't want to have. I have ADHD myself, and there are superpowers associated with it. People with ADHD can hyper focus on things better than anyone else when they're interested in it. Right. So ADHD is not actually a disorder of focus. It's more a disorder of modulating focus. So you can dive in deeper than anyone else when you have ADHD, but when it's time to focus on something you're less interested in, it can feel like pulling teeth.
Yeah.
People with ADHD are very creative. They connect things that other people don't. They put things together. They often are more intuitive as well. And that's because they're constantly scanning the environment, scanning people's faces. And picking up on some cues that maybe others might miss. But then there are real challenges too, like being able to focus, being able to control impulses, sometimes hyperactivity, sometimes mood control. People with ADHD tend to have a harder time with mood regulation. And that's the front of their brain, the prefrontal cortex, which is our brain's executive center and also our brain's brake pedal, is a little bit sleepy. And so if we have sleepy brakes, and we're feeling something big, that can look like a mood swing.
And would it be quite sort of easy for you to tell if you've got ADHD, or could it be quite hard for you to know that sometimes?
I think sometimes ADHD gets misdiagnosed. I've seen a lot of people come into our clinic who have been told that they have bipolar disorder, when in reality, they have significant ADHD symptoms. The main difference between the two, bipolar, people have periods of, a week, couple weeks, maybe longer. of very elevated moods or irritable moods, elated, and it tends to go with reduced sleep need. So maybe sleeping an hour to a night and feeling like you don't really need more.
Wow.
Racing thoughts, increase in goal-directed behavior. So taking on a whole bunch of things, but not necessarily having a good output all the time, and talking really fast. Those are some classic examples. And then that same person will then also have periods of deeper depression that are sustained, for at least a couple weeks, sometimes months. And that's different from the mood swings that are seen in ADHD. For ADHD, you could wake up feeling okay, and then later that day you hit just a roadblock and you're feeling really down, and maybe even later in the day you bounce out of it. So it's more of those quick minute to minute, hour to hour changes. And so one clue to whether or not you have ADHD is, do you have those kind of mood swings? But the other is, are you having a hard time with focus and organization? Do you get easily distracted? Are you forgetful? Do you lose things? Do you walk into a room and be like, wait, why am I here? Do you put down your coffee mug and then have no idea where you put it down? Those types of things. And then also some impulsive tendencies can be seen, and restlessness. Are you the person when you're sitting and your leg is bouncing up and down constantly? Those are all soft signs.
Some of the things you're mentioning, I'm actually thinking about myself. I'm like, maybe I have ADHD.
Maybe we'll have you come in for a scan and see, but it's not just the scan, the way we diagnose AD. I don't like to rely on any one thing to diagnose, period. So the scan is an important clue, but a detailed history is an important clue, figuring out what you were like as a kid, doing that whole neurodevelopmental history. And then neuropsychological testing. We do computerized testing where objectively we can see what people's reaction times look like on various measures. And then finally, like actually talking to the person and getting to know them and doing an exam. Put it all together, and then you can feel really confident about what's actually going on.
And what would be for the general person that has it, what would be the best sort of things that they could do, or would it be medications or things that they could do to help manage it, and make their lives a little easier?
Great question. Yeah. So first I focus on the basics, right? The 3 pillars of brain health: sleep, exercise, and nutrition. Without those being in place, it's really hard to move brain health forward for any indication, including ADHD. So for sleep, the basics are wake up the same time every day, no matter what, and get sun on your face as soon as you can, because that sets your circadian rhythm for the next 24 hours. It's even more important than when you go to bed. The second is only use the bed for sleep. So when people get into the habit of hanging out in bed, reading in bed, doing homework in bed, watching TV in bed, all of these things rob us of something called sleep efficiency. And sleep efficiency is the number of hours that you're in bed sleeping divided by the number of hours you're in bed, period. So for example, if you're laying in bed for 12 hours and only 6 of those hours are you sleeping, your sleep efficiency would be 6 divided by 12, 50%, which would be a terrible sleep efficiency. You want it to be 90% or more. So that means only be in the bed when you're sleeping. Okay, that way you can get into actually deep, restful sleep. And the brain is so active during sleep. So much stuff is happening while we're sleeping. The brain is literally cleaning itself while we sleep. So that's critical. And then the last one is turn off electronic screens an hour before bed, because the reason is our eyes, our brains have not evolved to being able to differentiate light from the sun versus light from a screen. And especially the blue lights that come through are very irritating to the brain. And so if that's coming through right before sleep, you might fall asleep. Sure, people can hypnotize themselves to sleep scrolling through social media, but you won't get into deep sleep, and you'll likely feel less rested the next day.
It's interesting when this is not a good thing to have, but there's a TV in the bedroom, and I do also read sometimes as well before bed, but sometimes we watch a movie or something, and I'll often fall asleep, while the TV's on. But I do hear you there, and I've also noticed that, like, I felt like I slept, but the next day I'm not as energized as I normally would be.
Yeah. Yeah. It's harder to progress through the stages of sleep when we've had that artificial light coming in at the very beginning. So if it's a tradition for you, to watch, you could even consider getting something like blue light blockers, some lenses on Amazon, $20, $30, dollars. And then maybe at least you're blocking out the blue light, if that's an important tradition. And if it's not an important tradition, then lose it.
It's a tough one, because it's sort of very comfortable for a lot of people, to if it's not a TV, then a laptop or a cell phone, and especially now with technology and social media and stuff, and that's another thing we can chat about now. But to be
Absolutely.
you're always on, and it's so hard to put it away and put it down, and that's usually the last thing people do before they go to sleep, is a quick check of what's the latest happening. It's pretty much the exact opposite of what you want before you go to sleep.
Exactly. And this is, our brains are co-evolving with technology, and technology moves faster than our brains do, unfortunately. But, it makes me think of something called revenge insomnia, where people have worked so hard during the day, they're running to work, they're taking care of their kids, they're doing all these things. And at the end of the day, it's like, okay, things are quiet around. I'm going to stay up a little later, because I deserve this. I need some of this downtime. And then people stay up and, far later than they would. And that's called revenge insomnia, because it's like I'm getting vengeance on how busy my day was. But then obviously the next day sucks. So it's a balancing act. I think, have I ever had revenge insomnia? Sure. But then you sort of have to just tell yourself what the cost is going to be associated with that. So that's one pillar, sleep. The other is exercise. Specifically, high intensity cardio seems to be really, really helpful for ADHD.
Interesting.
And the reason for that is, number one, when you're engaged in high intensity cardio, you are sending far more blood to your brain, and fueling areas of the brain like the prefrontal cortex is super useful. The other is you're naturally increasing serotonin level when you're doing that kind of exercise. Serotonin has a calming effect, and many people with ADHD have very busy brains, and being able to calm it down in that way helps enhance focus. Third, you're sweating, you're eliminating toxins, and we all live on Earth, so we're all exposed to toxins, and being able to eliminate some of that is also very, very helpful for brain health. So ADHD, one of the best natural treatments is exercise. And I find high intensity cardio to be probably the most effective. And that can look like 20 minutes, 4 days a week for people, as a place to begin. And if someone's not exercising at all, start with a 20-minute walk 4 days a week, and then gradually work up, to a place where you're huffing, puffing, feeling like you're really pushing yourself.
Why is the high intensity work so much better than steady state sort of aerobic exercise?
There's something about that fluctuation between giving it your all out effort, and then going down to just a moderate degree of exertion, and then giving your all out effort again. There's something about that, studies in cardiology have found, studies in neurology have found, that just seems to be more effective at cleansing the brain. And
I heard a statement. I can't remember where exactly I heard it, but it was something that it's like 95% of people or something like that after the age of 30 will never sprint again. Something like that, which I thought was fascinating, but it's actually probably true.
Yeah, I unfortunately, it probably is true. I haven't heard that statistic, but it's not too surprising. And
Yeah.
then the third pillar,
uh,
sorry, what were you going to say?
No, it's fine. You can carry on.
I was just going to say the third pillar is nutrition.
Mm-hmm.
And this is a big topic, it's a big topic, but ultimately food is either inflammatory for our brain or it isn't. And the main three food groups that tend to be inflammatory for most people are refined sugar. And that's a hard one to cut out because sugar's in everything. If you really read the label, sugar gets snuck into all kinds of things that we don't necessarily need it snuck into.
Mm-hmm.
But obviously sugar tastes good and it's highly addictive. There are studies that have been done on rats where they're offered either sweetened water without sugar, artificial sweetener, that has cocaine in it, or sugar water. And the rats go back to the sugar water because
Wow.
sugar, the conclusion of that particular study was after controlling for various elements, sugar was more addictive than cocaine.
That's insane.
It's insane. And this is why, people say things like, well, I need my sugar. I miss my sugar. I crave my sugar. Yes,
Mhm.
highly addictive. I understand, but it's also highly inflammatory. And anything that inflames the brain takes areas where if blood flow is lower, it lowers it further. And if there's an area of the brain where blood flow is hyperactive, it heightens it more. So basically, it's taking whatever we're dealing with and pushing it to a more extreme level.
Mm-hmm.
So that's sugar. Gluten is the other one. And part of this depends on where someone lives. I would say gluten in the US tends to be more problematic than gluten in other areas, like let's say Italy. Part of it has to do with how it's been raised over centuries, but some people also can have a specific gluten sensitivity, and there's a way to test for that through blood testing, but that can be inflammatory. And then the last is processed foods, which again is, more of a Western issue, but can be an issue anywhere. If you read the label and you can't pronounce what's in it, it's probably not good for you. So those are the things I suggest that people try to avoid, especially if they have ADHD, but really any of us. And then the best type of diet would be a Mediterranean style diet that leans paleo. So plenty of lean protein, assuming someone's not a vegetarian, wild salmon, turkey, chicken, grass-fed beef, bison on occasion, plant-based proteins, egg, healthy fat. The brain is 60% fat after you take the water out. So things like avocados, nuts, seeds, coconut, olive oil, fruits and veggies, eating the rainbow every day, not Skittles.
Yeah.
Some fruits are better than others. Some fruits are very high in sugar, like mango, pineapple, grapes. So moderation there, but plenty of berries and melons and citrus and apples. And then complex carbs, things that don't just spike your blood sugar and drop it, but things that sustain a nice level of glucose in your bloodstream. So examples, quinoa, sweet potato, millet, wild rice, these are just examples, but that type of diet, when people can really stick to it, they're often going to notice improvements in their ADHD symptoms, even without a medication. So that's the first step, is the basics. Then you think about things like supplementation. There are certain supplements that have been proven to be helpful for ADHD. Things like fish oil has been shown against placebo to be helpful for ADHD. Things like vitamin D supplementation, being on a multivitamin if you're not adequately getting your nutrients over the course of the day. There's other specific supplements like ashwagandha, rhodiola, ginseng, phosphatidylserine, dogenol. I mean, there's an abundance of options out there, and part of it depends on what someone is dealing with in particular. And I wouldn't throw everything at. I wouldn't want a listener to hear that and go buy all those things and start taking all of them. I think it's important to have some guidance on what you're taking. Then you think about things like neurofeedback, training your brain to fire in the way that you want it to fire. You think about behavioral therapies, setting up your life to create systems that help you avoid the challenges of ADHD. So structure, routine, having a clear desk space, setting up yourself to do 20-minute sprints of focus and then 5-minute breaks, and then rinsing and repeating that cycle. Those are all examples. And then, of course, medication can be something that is useful for people, and that's a whole world. There are 2 classes of ADHD medication: stimulants, which essentially work to increase dopamine and norepinephrine in the brain, which are the fuel for the prefrontal cortex. And then there are the non-stimulants, which work in a different way, but can be more useful for certain types of ADHD. There's a lot of treatment options for ADHD. People don't have to quietly suffer with the challenges. I think really the first step is asking yourself, does this sound like me? And if it does, get an assessment, and try to get an assessment at a place where they're not just only talking to you and giving you 10 minutes of their time.
I think there's a lot more. It seems to be that there's a lot more awareness about it, and there's becoming a lot more awareness about it over the last few years. Compared to when I was, in school and growing up, it was sort of I don't know. You didn't hear about it as much, and now it's sort of much more widely spoken about, which I think, hopefully is going to be helpful for people to be, get them on the right track.
Absolutely. I mean, I think ADHD and a lot of other mental health conditions are being spoken about more. And I think that's a good thing, because ultimately stigma has been something that has prevented people from reaching out for help. And the more we can do things to reduce stigma, the better. And as far as ADHD publicity goes, I think we have social media to thank and also blame at the same time. Because the beauty of social media is a lot of people can be reached, a lot of people can share their experience, there's this vast amount of information at your fingertips. But at the same time, I think one of the reasons that ADHD is on the rise is technology in this post-pandemic world, where people have been on their screens a whole lot more. And I think this is something you were wanting to talk about, but when we're on a screen and we're scrolling through various reels and we're just swiping, what's happening in the brain is it's dumping dopamine, literally dopamine dumping ground. We're just draining our brain of dopamine because it feels so engaging and we're getting this constant stimulation. But the problem, especially with ADHD, is you don't want to dump your dopamine. You want to slowly drip it over the course of the day. And so when people are scrolling and then shifting to trying to do something productive for work or school, that's excruciatingly challenging because you've dumped your dopamine and now here you are sitting in front of a task that might not be as engaging or interesting, and you're trying to focus on it. So I tell people, be careful with technology. I don't think technology is the enemy. I mean, as I mentioned, I have an Instagram account. I would be a fraud if I said, don't ever go on social media. But I think we have to be very calculated about how we do it.
So ADHD can be developed. It's not something that you're born with necessarily.
Well, classically, ADHD is a neurodevelopmental condition. So it's something you're born with. However, things can either help or worsen ADHD symptoms over time. And for example, technology is one. You might have someone who has mild symptoms of ADHD and then they find themselves addicted to the phone and scrolling, and then now suddenly the symptoms are much more exacerbated. Similarly, you can have people who develop head injuries, and we can talk about that later, but head injuries can lead to ADHD symptoms. And so in someone who had ADHD and got a head injury, it can make the ADHD worse. In someone who never had ADHD and they have a head injury, they can develop symptoms that look like ADHD. And there's other things too that can worsen ADHD symptoms over time, like emotional trauma can do it. In women, perimenopause can do it. There's a number of things that can worsen it. Another is just having more demands on your plate.
Mm-hmm.
When I worked at Stanford, I would see undergraduates who would come in, and in high school they were fine. They didn't really notice anything because super smart, they were able to get by. And then now they get to university and there's piles of things waiting for them to do, and they realize, oh my goodness, I'm having a hard time here focusing because the supply to their prefrontal cortex is no longer meeting the demand that's being placed.
I mean, with social media and technology, I mean, that's a huge, part of my life, as with most of us, and particularly obviously with what I'm doing, being an athlete, having been an athlete, creating content. You're always on social media scrolling, whether that's to, search for some fresh ideas or creating things. But and it's amazing on the one side, because it's enabled people like myself to make a living and do what we love, for the most part. But at the same time, it comes with a whole list of, demands and pressure that goes with it. And it is very addictive. And it's you find yourself picking up your phone and tapping on Instagram without even thinking about it, like that's like the first thing. You pick up your phone and it's like, open up Instagram. And sometimes you don't even realize you're doing it.
Yeah.
Until I actually did a test. I actually removed the app from my homepage, and moved it further, so I had to swipe for it. And that was the first time that it sort of dawned on me as I wanted to click on it. And I was like, why there's no need for me to go into Instagram right now.
Yes.
But I think in general, I've certainly noticed in my life, and I'm sure other people have as well. I mean, I've seen that seems to have been a rise in mental health problems with the younger generation. A lot of my friends I'm, as I said before, I'm on an SSRI, and we can get into why that is. But, I think a big problem is the social media and this sort of perceived perfect life that everyone's living, and we're always on all the time. We never get a chance to switch off because people are WhatsApping you, people are emailing you. You're seeing this message come up on Facebook and Instagram, and then this one's on holiday here. And I mean, it's just like, it's so much for us to process, and there's never a time to really actually switch off. I think it's doing a number on particularly the younger generation that's so into it and had that from when they were small kids.
Absolutely. And that's what I was alluding to when I say technology evolves faster than our brains do. There is so much content that our brains are downloading on a given day. And if you think about, even when I was a kid, there was much more quiet time. There was much more time to just play with your toys or be in your thoughts, or go for a walk, or whatever the case may be. But even if you go for a walk nowadays, unless you're not bringing your phone with you, you're getting pinged left and right. As you said, a text, a WhatsApp, a missed call, an Instagram notification, TikTok notification. And what's interesting is technology addiction shows up in brain scans the same way that substance addictions show up. It's the same structures in the brain that light up. There's a particular structure called the basal ganglia in the brain. Okay, it's deep inside the brain. And the basal ganglia is both the addiction center and the stress center. Okay, stress, like fight or flight. And inside this structure, there's a tiny little piece of it called the nucleus accumbens. And its job is to release dopamine whenever we do something that feels good. So that could include drugs, that could include gambling, that could include technology, right? Scrolling through Instagram. But here's the issue. It releases dopamine, but the longer we do whatever that activity is, the less dopamine gets released. You can think of it as a lemon in a lemon squeezer. You get a ton of juice over time, less and less and less. But the rest of the basal ganglia says, hey, where did all the dopamine go? And it ramps up in activity because it's trying to milk what it can get. But ramped up basal ganglia stress, anxiety, tension, restlessness. So when we're not actively engaged in the behavior, we feel more tense, and it's like we need to check. It's almost like we have to check. So you could show me two scans with really hot basal ganglia. One of them could be someone who's addicted to methamphetamine, and the other could be someone who's addicted to their phone.
That is crazy.
This kind of stuff really does hijack our brain circuitry. And as you alluded to, technology is not going anywhere. Social media is not going anywhere. It's part of our life, and it does offer plenty of very useful things, as careers, opportunities to connect with information that we never had the opportunity to before. But it also hijacks our brain. And for those of us who lose perspective, it's really hard to constantly compare the worst parts of your life, because usually when we're scrolling, one of the reasons is we're sort of bored, to the very best moments of other people's lives. And our brains can lose context knowing that, okay, these things that are being filmed, a lot of times there's a whole crew, there's a whole setup, there's a lot of thought that's being put into this post. And it's not necessarily an accurate reflection of how someone is living their everyday life. But that discrepancy leads to higher rates of anxiety and depression in people, because it feels like, well, my life sucks compared to what I'm doing.
And I think, I've experienced that myself. I wanted to chat a little bit about anxiety and also panic attacks as well, because that was, something that I've been through. And, for those that don't know, I had 2 major injuries, broke both of my hips over 2 years. And basically I was, sidelined for a couple of years. And then also at the same time, I'd lost majority of my sponsors. So I was under that stress as well. And I was going through a relationship breakup at the same time. And then I got diagnosed with a melanoma, and all within the space of 2 years. And then just out of the blue had a panic. And I was never someone that really understood mental health. I was just thinking like, people just need to pull themselves together. It's just be stronger. And then, out of the blue, had a panic attack while I was watching a movie, just randomly, out of nowhere. I thought I was dying. Thought I was having a heart attack. I was 100%. We went to the hospital, and I told them I'm having a heart attack. And
that's how it feels.
It's crazy. I couldn't. You really can't believe that your body can have that reaction. And it feels so real, having this hot flush and you can't breathe and your heart's pounding and you're like, what is going on? And after spending 4 days in hospital and getting numerous tests done, they basically came back and said that it was a panic attack. And I wouldn't believe them at first. I just said, there's no way. And it's insane to me how the body, obviously has to deal with so much stress and trauma. And basically they explained it to me that when you've had a certain amount of trauma, it's like a glass being filled up, and you can only take so much. And when the glass overflows, it can happen at any moment, then something has to give. And in my case, I had a panic attack, but it could be severe depression or, anything like that. And I just thought it was unbelievable that the body can have that reaction. And it's given me a whole new respect to people that do suffer with mental health, because it's very real, and the feelings that you have you can't control them. And I struggled with that for a couple of years afterwards, even when I felt sort of okay, but just having weird symptoms, having pins and needles in my hands, and all of a sudden your throat's tight and out of nowhere, and then a couple hours later, it's gone again, really random things.
Absolutely. And, this really gets at this idea that mental health is not separate from biological health. They are one and the same thing. When people say, well, the depression's all in your head. Okay, sure, you're right, because the brain is in the head. And the brain controls everything, including our movements, the way our heart beats, the way we breathe. I mean, every fundamental function is being controlled by the brain, and stress has to find a way out of the body. The body is not designed to hold on to extreme high levels of stress in perpetuity. It has to find a way out. And for some people, that comes out emotionally, right? As you said, depression, anxiety, talking about those things. And for other people, it ends up coming out physically. And that's what a panic attack is, right? A panic attack is a flood of stress hormone, norepinephrine, surging through the body, causing our heart to beat harder and faster, causing us to feel sweaty and shaky, causing us to feel like we're dying. And I've seen other examples of stress coming out physically that doesn't include a panic attack. For example, people who suddenly can't walk, people who suddenly can't see, people who suddenly have weakness on one side of their body and it seems like they're having a stroke. There's actually a diagnosis for this. It's called functional neurological symptom disorder, where essentially someone is having neurological symptoms in their body, but structurally everything looks okay. They see a neurologist and the neurologist says, well, your MRI looks good, your spine looks good, we did an EEG, it looks good, nothing going on, and yet they can't walk. And it's because their brain is now speaking a different language than their body is, because the communication has been interrupted by high levels of stress. And it just goes to show you, mental health symptoms can come out physically, and a panic attack is a very good example of that.
Another thing which I experienced, which was also crazy, was obviously insomnia, which a lot of people struggle with. After that, it happened, and also it's hard to explain, but I wasn't able to focus on anything, on certain things. Like, it was really weird. Like, I'm a mountain biker, and I couldn't actually go out ride. I was too scared to go riding at certain points because I couldn't focus on what was coming. It was weird. Like, my depth perception wasn't there. It was really bizarre. And it was almost like, I guess, maybe also something like brain fog as well, which maybe we could talk about a bit as well and how that relates to it all. But it was such a crazy feeling. It was almost like you'd taken a drug that you'd been a bit drunk or something, that you just couldn't focus properly.
Yeah, well, and there's a good reason for that. When we're in this constant state of fight or flight, and we have so much stress hormone floating through our body, the part of the brain that heats up is the same part we were talking about earlier with addiction, the basal ganglia, the stress centers, the fight or flight centers. And those are deep in the brain. And remember, the prefrontal cortex, the focus center, the executive center, is right at the front. And when the basal ganglia are screaming, it essentially creates background noise that drowns out the prefrontal cortex's ability to lock in and focus. And so for this reason, many people with severe anxiety also have a hard time focusing, and it can look like ADHD symptoms. And for really bad anxiety, it can also show up as kind of this dissociated feeling, like derealization, feeling disconnected with your environment, like the world around you is moving at a slightly different speed than you are, or things feel a little distorted, a little off. It's hard to really lock in. Or depersonalization, you feel disconnected from yourself, even like you don't feel yourself in your body the same way you used to. And all of it stems from that really heightened anxiety state and the biological changes that are occurring during that state.
And would this be like something like brain fog? How would that tie in? And maybe you could walk people through sort of a bit more about what that is, and because that's something that I think a lot of people suffer with.
Absolutely. So brain fog is sort of a big umbrella term. It basically describes people who feel like their thoughts are floating through molasses, right? Like being able to connect A to B just takes longer. People can feel fuzzy. People can feel fatigued. People can oftentimes also feel depressed with that, but your thoughts just aren't as crisp with brain fog. And there's a lot of reasons to have brain fog. One of them, going back to how we see brain fog on scans, we tend to look at two different views of the brain. One is the outside of the brain, which is the cortex, the thinking brain. And some people with brain fog, when you do their scan, will have a scalloped appearance across the surface of their brain. Not literally scalloped, but the blood flow pattern is reduced in certain areas of the cortex. And that tends to lead to brain fog. And the top reasons for that are head injury is one. You can see scalloping following head injury. Another would be toxin exposures. So that can be environmental toxins like heavy metals, paint fumes, pollution, pesticides, solvents, or voluntary toxins like drugs, alcohol. And then the other reason to see it is inflammation. And inflammation is a big cause of brain fog. And ultimately, inflammation is at the root cause of all disease. I mean, any disease you can name, including depression, anxiety, etc., usually inflammation has something to do with it. And so then you start to wonder about, well, why is that person inflamed? Is it residual healing from a head injury? Is it the food that they're putting into their body? Is it a lack of sleep? Is it some other medical condition that's contributing? So that's one way of understanding brain fog. The other is, if you look at the deeper parts of the brain, if they're overactive, again, it just drowns out our ability to focus. So is someone dealing with high levels of anxiety and depression, and maybe they're not even fully aware that they are, right? Sometimes developing those conditions doesn't come on as a in-your-face panic attack where it's very obvious. Sometimes these are very internalized conditions. And we might just notice that, gosh, my energy hasn't been as good. Like, I'm kind of withdrawing a little bit from people. I'm not as interested in the things I was interested in before. And that can be depression creeping up. And depression is a very common condition. And one of the symptoms of depression is you have a hard time focusing and you feel like you have brain fog. So there's a number of reasons for it, but it's obviously very important to address. It's hard to live with brain fog for a long time.
Yeah. And if, obviously it's kind of hard because there's so many different causes of it, but I mean, what would you say would be the best sort of course of action if someone does have brain fog? Where should they start looking for answers?
Figure out the cause. Figure out the cause is the most important step. So get an assessment, talk about having brain fog, and then have a professional work with you just kind of through the steps of eliminating what the possible causes are. Because again, there's no one treatment for brain fog. It really depends on what the underlying cause is.
It's it's interesting that you mentioned there with the depression like creeping in, because that was before I had my panic attack. Obviously, all of that time before was extremely high stress and trauma and etc. And I obviously I knew I was stressed, but I started to have days every now and again where I would just feel sad. And I was sort of I noticed it. It didn't go unnoticed, but I was sort of thinking like, why am I feeling like this? Because I don't really have a reason to feel like this. And obviously it was, the body trying to cope and deal with what was happening, and then ultimately led to the panic attack. But there are sometimes signs that your body gives you, which people often overlook, I think.
Yeah. And that's where I think being able to engage in some kind of mindfulness practice, whatever that is for the person, whether it's meditation or coloring or painting or surfing, like some kind of mindfulness practice where you just give yourself an opportunity to just check in on yourself. How am I feeling? How are things going for me right now? Anything I'm noticing popping up, any sensations, just being aware, because we don't live in a mindfulness-based society. as we talked about earlier. We're constantly being pulled in every direction other than internally. So carving out that time is pretty critical for every human being.
It's interesting. I find it so interesting when you go out to a restaurant nowadays and you see a couple there at dinner and both of them are sitting there on their phones.
Or a Thanksgiving where every single family member is scrolling through whatever it is, and here we all are in the same room, and people have almost forgotten how to connect. Because as opposed to connecting to one person in the room, you're connecting to 50 people on your phone.
And
what's the quality of the connection?
And I've noticed it is directly related to how I feel, which is quite scary sometimes. Like, especially with the social media side, and if things are going well, you feel like, obviously, especially if it's your job or your business, for things to go well, you feel like on top of the world and like, everything's great, but things don't go well and people don't engage and your content maybe is not doing as well, and then you feel kind of not worthless, but your worth goes down, which is not good, actually.
And then your brain is very much chasing the next dopamine hit, right? A post that goes viral.
Exactly.
That can feel to the brain like hitting the jackpot at the casino.
You touched on a little bit earlier with the injuries, which is something I wanted to chat about as well, and how that affects things. And obviously, in the sport that I've done, people crash and have a lot of head knocks, which I think often go overlooked. And especially, I think some sports are worse. When you talk about football and things like that, where they're having continuous knocks to the head. How does that? What are the long-term effects? And I know there's something that's come out in the last, I don't know when it came out exactly, maybe 10 years ago, CTE, that has led to athletes committing suicide, unfortunately, due to how bad the symptoms were.
Yeah, well, let's talk about it. So brains are the consistency of room temperature butter. Brains are very soft, right? It's a very delicate organ. They're surrounded by a thin layer of fluid, which serves as a shock absorber, which holds up pretty well for day-to-day things, running, jumping. But when we take a big hit to the head, and that could be a direct hit, it could even be a whiplash injury, it could be a fall. What ends up happening is, like, I'll use this model here. Let's say you've hit the front of your head. Your skull stops moving, but your brain slides forward. And there's a buildup of pressure at the site of impact, which corresponds to reduced blood flow and reduced activity. But then the brain's not done there. Every action has an equal and opposite reaction. So it ricochets backward. And now you get a similar buildup of pressure towards the back. And you can see reduced blood flow there. But then the final thing is, now that the brain is wobbling back and forth, like jello in a bowl, these guys here and here are known as the temporal lobes because they're located right by the temples. They live in a bony cavity in the skull here and also on the other side here. And there's all these sharp bony ridges. And so if this soft buttery brain is bumping up against sharp bony ridges, you also end up seeing reduced activity in the temporal lobes. So let's talk about each of those regions and what they do. Front of the brain, we already talked about. Prefrontal cortex, focus center, impulse control center. So if someone's had multiple head injuries or even one big one, it's like their brain's brake pedal is cut. And so now if we're dealing with really strong emotions or impulses and we don't have brakes, that's a risk factor. That's a risk factor for things like suicide or even just deeper negative emotional states. The back of the brain is called the occipital lobe, and it's the visual cortex. So even though it's the farthest from the eyes, it's what processes visual information. And some people who have had a head injury might notice sensitivity to lights. Driving at night is a little bit harder. Their eyes strain more quickly when they're reading. The words can even feel like they're kind of dancing on the page. That doesn't happen to everyone, but if it does happen following a head injury, that's the part of the brain that's involved.
Mm-hmm.
And then the temporal lobes are absolutely critical. The temporal lobes you can think of as our temper lobes. They're very important for mood regulation. And the analogy I usually tell people is, imagine you're at a bowling alley and you're holding a bowling ball. The bowling ball represents whatever you're feeling emotionally. And the temporal lobes are like the bumpers or the guardrails you can put up for children when they're bowling. When the bumpers are all the way up, fully on, bowling's easy. You don't have to try. But when they go down, we're much more likely to roll a gutter ball. And if the bowling ball represents sadness, you're more prone to depression, anxiety, panic, stress, overwhelm, anger, rage. And people are much more likely to experience these really significant mood swings, where they feel stuck in that gutter. And so if you put all that together and someone's had a head injury, the most common neurological side effect of a head injury is depression, most common. And so now you're dealing with a depressed state.
Really? Wow.
Most common. You're dealing with a depressed state. Your brakes are down and your bumpers are down. That's a recipe, right? That's a recipe for being in a very vulnerable state. The good news is, there are things people can do about it, which we can talk about, but that's why people post head injury usually are dealing with significant mood swings and impulse issues. And if that's not treated or addressed or acknowledged, right? A lot of people, long time CTE wasn't acknowledged, and actually Amen Clinics helped with some of the data on getting that out, in part with a study of over 300 former NFL players. Once it's acknowledged and people talk about it, then, we can actually do something about it, as opposed to CTE being denied or covered up.
When you mentioned having an impact to the head, or does it have to be a direct impact to the head, or can, because there are a lot of times that you'd fall and it could be a really hard fall, but you might, your head might go wag forward.
That's more of a whiplash event, which can also show up on a brain scan. It doesn't only have to be a direct impact.
Because I think, as I said, I've had one sort of concussion where I'm really aware that it was a concussion in my life, but I'm sure that I've had others, because there's also been many times where I've hit my head, not seemingly not that hard, but you kind of shake it off, you have a little head thump
in the game. Yeah.
But I think it's the sort of never say die attitude of the sports world, that it's just push through it and you can get to the finish, but what are the big risks, the risk factors for people that do hit their head, even if maybe the concussion wasn't that serious, but they just keep going,
One big risk factor that you think about is future memory challenges. And the reason for that is, we talked about the temporal lobes as being the emotional bumpers. They're also critical for memory. And the reason for that is the hippocampus, the main memory structure of the brain, lives inside of the temporal lobes. So anything that we do over the course of our life that negatively affects the health of the temporal lobes worsens, increases the risk of us having memory issues later on in life. And there's other things that affect the temporal lobes: sleep apnea, chronic stress, toxins, as some examples. So this is one risk factor for developing memory issues later on. And then I would say mood-related issues. I think head injuries are important to address, and there are things that can be done to help. In our study of 300 former NFL players, these players had scans at the beginning and computerized testing at the beginning, and then they had scans at the end of the study. And during the study period, some pretty basic interventions were implemented. If they were using drugs, we tried to have them stop. If they weren't exercising anymore, post-NFL career, got them exercising again, eating right, promoting good sleep. and supplementation.
Mm-hmm.
And then for a subset, people also can benefit from things like hyperbaric oxygen, which I can talk about. At the end of the study, scans look way better, people felt better, and on the objective measures of cognition, anywhere from a 25 to 75% improvement, depending on.
Wow. Okay.
So brains aren't stuck, right? We like to tell people, you're not stuck with the brain you have. Brains can change. There's a lot of plasticity within the brain. It just depends on what environment are we putting that brain in, and can it achieve healing? The body wants to heal itself. Can we let it? And can we give it the ingredients that will help it accomplish that job?
Mm-hmm. Why is it that some people get such severe symptoms after a knock to the head and others don't? Where, for example, like when I hit my head, I couldn't remember for 15 minutes. I was just saying the same thing over and over, but yet afterwards I had absolutely zero symptoms, like no nausea, no headaches, no nothing. Basically, from the next later that day, I felt normal and I never had a symptom again. And yeah, there's so many other, people that have head knocks where they weren't knocked out, they weren't repeating themselves, but then a few days later, these symptoms start developing, where depression, nausea, headaches, all these things.
Yeah. So a few things. One is, what did the brain look like going into the injury? So in your case, you strike me as someone who's healthy. You've been someone who's physically active. You probably eat right. There was probably a whole lot of reserve going into that hit. Someone else could go into the same hit, and maybe they've had previous concussions. Maybe they're actively using a lot of substances. Maybe they're not eating well, they're not exercising, etc. And so their reserves are lower. So that's one thing. What did the brain look like going into the hit? The other is, what was the hit like itself? What was the mechanism? How significant was it? And the third is, did someone have significant pre-existing mood issues? Because if you have substantial mood issues prior to the head injury, and that bowling ball was heavy, and then the bumpers have come down, it's even harder to contain a heavy bowling ball compared to a light bowling ball.
Yeah.
Okay, so a lot of it has to do with what is the health of the brain coming into the injury.
Crazy. Yeah, that's because that was something that I always wondered, because I always thought, obviously you do think about yourself, and when you hear how things affect people, and with CTE, who are the biggest risk groups for that, and like how many hits do you need, to develop something like that?
Again, it's going to depend on the individual, but biggest risk groups are high impact sports. American football, NFL, boxers. These are the populations that I worry about the most in terms of developing CTE. But usually you're talking about someone who has sustained hundreds of hits to the head,
Wow.
if not thousands of hits to the head over time. You think about a boxer in the ring. One match, a lot of hits to the head. MMA, same thing. In a standard NFL game, depends on the position the person is playing. Hopefully, if they're a quarterback throwing the ball, they're not taking as many hits to the head. Although we've seen, with the Miami Dolphins and their quarterback Tua, he's already sustained a number of serious concussions as a quarterback. But a running back probably going to sustain a whole lot more, especially if it's a physical running back who's leading with their head. A defensive safety might sustain a lot making a tackle. Linemen, bumping up into each other. So there's some positional risk factors too with football.
And is this almost a certainty if you are taking those hits that you will develop this, or do some people just genetically have a bit of luck and don't get it?
Yeah, it's not a certainty, it's a risk factor. And I think if someone I'll say this: I have a 6-year-old boy and a 3-year-old boy, and neither one of them is going to be playing football, even if they're very interested in it, right? But let's say a child is growing up in a family where football is life, and it's ingrained, and they love it and they want to play. Let's do everything we possibly can to build up reserves in that person's brain so that if they do take a hit, it's less likely to knock them back. So if you're going to be playing football, we better make sure you're eating right. We better make sure you're probably going to be getting exercise through football. We better be sure to protect your sleep. We should probably get you on some supplements to protect your brain. And maybe you consider something like doing occasional hyperbaric oxygen treatments to make sure you're replenishing your brain and keeping that reserve up.
You mentioned the supplements there. What sort of what are the main supplements that have the biggest impact on the brain?
So the basics, fish oil, high dose fish oil, a brain directed multivitamin. So that includes various ingredients that are brain boosting. And then a few other ingredients, things like ginkgo, huperzine, alpha lipoic acid, and acetylcysteine. These are ingredients that have been shown to be helpful for either boosting blood flow to the brain or reducing inflammation. We make something called Brain and Body Power Max, and it's a pretty top of the line supplement for helping with head injury. But there's many examples out there as well.
And I mean, you also talked about the diet. I mean, I'm assuming that taking supplements is secondary to having the right diet. I mean, what's your thoughts also, that there's so many different diets now, whether it's plant-based or ketogenic or carnivore, what does the sort of research say? And I mean, what's the best things for people to be eating?
Again, I think it depends on what the person is trying to accomplish. There are some people that benefit from going on a ketogenic diet if temporal lobe health is a major concern. Ketogenic diets are used in medicine for people with epilepsy to help control seizures. And the reason for that is most seizures originate in the temporal lobes. So a ketogenic diet seems to have a calming effect on the temporal lobes. And if that's affecting someone in other ways other than seizures, it might be reasonable to try that. But I am ultimately a fan of moderation and balance. And that's why I think that Mediterranean style diet that leans paleo, avoiding sugar, minimizing gluten, avoiding processed food, for most people, that's going to be a good bet.
And I'm assuming actually having a decent amount of fat in your diet is very useful for the brain, seeing that the brain runs on fat.
Absolutely. Yeah, the brain is 60% fat after the water is removed. So you need fat. It's good to have a fat brain.
What's your thoughts on cholesterol? Because obviously there's been a lot of demonizing of cholesterol over the years, and now that seems to be changing. But there's a lot of opposing views on whether high cholesterol, low cholesterol. But I actually heard in another podcast recently that people with higher cholesterol generally have lower instances of Alzheimer's, for example. I don't know how true that is, but that's what I heard. What's your sort of thoughts on the cholesterol side?
Yeah. So if it's too high, you worry about buildup of plaques and reduced blood flow to the brain, and specifically LDL, the quote unquote bad cholesterol. If it's too low, that's actually associated with things like increased risk of suicide and aggression. So finding that balance is important, and just checking it on occasion. I think not everybody needs to go on a statin medication to lower their cholesterol to some very low number. But that's one where you want to work with your doctor and make sure it's not too high or conversely too low, because too low can be just as dangerous.
And touching back on the Alzheimer's and dementia side, my grandmother actually passed away of Alzheimer's, so I've got it in the family, and it's actually on both sides of the family. So it's definitely something that's is on my mind. Maybe I could take us through what ways that we could sort of hopefully prevent that from becoming a part of our lives.
The more we talk, the more I think you should come in for a scan.
Well, I definitely, as we've been talking, it's definitely crossed my mind a few times, to be honest.
Yeah, well, I'd be happy to see you. So in terms of how we think about risk factors and modulating risk factors, we actually have this mnemonic called Bright Minds. Each letter stands for a particular risk factor for developing memory impairment later on. The B stands for blood flow issues. So is someone hypertensive? Is someone not exercising, not getting their blood flowing? Does anyone have any other sort of buildup of plaques, etc.? That's one risk factor. That's the B. R stands for retirement, which really means aging in and of itself. And we can't control aging. But what you can do is make sure that we age gracefully, right? So one issue that many people find is it's the isolation and the loneliness that comes with aging that can be most problematic, and people might be watching TV for more than 2 hours a day. That's a risk factor. Okay, so connection in the community, social engagement is protective. The I stands for things like inflammation. So getting at the root cause of any inflammation that's present. Could it be diet? Could it be gum disease? Could it be something else? And there are blood markers that can help understand what someone's inflammatory level is. And then we think about things like the mental health of someone, right? That's the M of Bright Minds. So how's stress control looking? Is someone managing their stress effectively? Is someone talking to someone, working through stressful situations? I jumped around a little bit, but to go back to the G of Bright Minds, that's genetics. Yeah. So it is true that having a family member with Alzheimer's disease can increase the risk. There's a test for that, and some people might choose to do it, some people might not. But it's called the ApoE4 gene. And if someone has one copy, it increases the risk by 2.5-fold, and 2 copies, it increases the risk by 10-fold. That doesn't mean someone's going to get it, right? It just means that person should be that much more proactive about making sure all these other risk factors are on point. The H is head trauma. And we've talked about how head trauma can impact the temporal lobes and memory. The T is toxins. So things like nicotine, alcohol, environmental toxins, radiation, kidney or liver disease. So trouble like detoxing the body. We talked about the M already. The I is immunity and infectious issues. So does someone have a chronic infection of some kind? The N is neurohormone deficiency. So what's someone's thyroid looking like? What are their sex hormones looking like? Low testosterone in males and females can be a risk factor. D is diabetes. So for young people, being overweight or obese, and for old people, being underweight is actually a risk factor. And then the final one is the S, which is sleep issues. Does someone have untreated sleep apnea? Does someone have chronic insomnia? So if someone can think about each of those risk factors and do their very best to address each one, they're going to be in a much better place. And Alzheimer's is preventable. You know, we see data on our scans where someone comes in and their scan may show evidence of the brain wanting to head in that direction even 30 years before someone ever develops symptoms, which means you get a head start and you can do something about it. And so it's not most people are led to believe that once they start losing their memory, well, that's it, you know, little to be done. But if we're proactive and preventative, we can save a lot of people's lives.
And if someone is starting to actually have issues, you know, with memory, is it then too late, or is there still something that can be done even if they are a little older?
Yeah, no, it's still not too late. The goal is, first off, to slow progression, but that's like a primary goal. But the next goal is to actually halt and even reverse some of that progression. And the data out there for things like supplementation, things like hyperbaric oxygen has a lot of data to show that it can be helpful in treating dementia.
What is, I mean, I have heard a little bit about that, but maybe you could walk people through what that is exactly, hyperbaric.
Yeah, absolutely. So hyperbaric oxygen chambers are basically these chambers you lay down in, and they're pressurized and they fill up with oxygen. And there's different levels of chambers, some higher pressure, some lower pressure. It turns out that the lower end pressure ones are very, very good for brain health, and you don't really need the super high pressure ones. So we're talking about 1.3, 1.5 atmospheres of pressure. And the idea is oxygen normally is transported on red blood cells in the body. Okay? And the red blood cell can only carry so much oxygen. So if you do a pulse oximeter and it says 99, 100%, you could breathe all the oxygen you want. You're not going to go over 100%. But the idea is when you're in the pressurized chamber, the pressure exerts a force that kicks the oxygen off of the red blood cell into the liquid part of the blood, the plasma. And then the red blood cell restocks. So now per milliliter of blood, you're carrying more oxygen than you otherwise would, which means your tissues see more oxygen, including the brain tissues. And more oxygen leads to less inflammation, better blood flow, vascularization, and stem cell growth. And that is really helpful in head injury, but also in dementia or memory impairment or someone who's trying to prevent that.
Crazy.
So that's how it works. Yeah. Usually it's the standard protocol for hyperbaric oxygen. And again, people should consult with a physician, but the standard protocol is pretty intensive. You know, it's an hour each time, ideally 5 days a week for 2 months. You're trying to get to 40 total sessions, and then you reassess and go from there.
And in terms of other interventions, maybe something like fasting, has that been looked at? What effect does that have on the brain?
Yeah, I myself intermittent fast and recommend it to many of my patients.
I just finished, I did 2 weeks ago, I did a 3-day water fast, which was the first time I've ever done that in my life, which was pretty tough, but pretty amazing.
How do you feel?
I felt better on the 3rd day, which was interesting. That it actually got easier. But it's when you tell people that aren't sort of in the health space and haven't tried anything like that, they look at you like you're crazy. Like,
well, I think people can start, something even far less intensive than that. Like what I do is I do a daily 16-hour intermittent fast, 6 days a week, right? So usually around 7 p.m., I stop eating, and then I don't eat anything until 11 a.m. Usually it ends up being 12 the next day. And then during the fast window, it's just things like water, tea, plain tea in a tea bag, nothing added. Or if someone's a coffee drinker, which keep that in moderation, black coffee, those are the things you can have during the fast. And then do that. That amounts to 16 hours of fasting. Do that 6 days a week and have one day where you don't necessarily do that, just to keep your body guessing. So you don't land into a steady state. And the data on intermittent fasting are absolutely incredible. It's one of the best ways to improve metabolic health. And it is associated with longevity, better cognitive functioning, better memory. So I'm a big fan. There was recent data that came out around cardiac concerns with intermittent fasting. It seems that data was not of very good quality, but that being said, as with anything, people might want to consult with their physician, especially if they're having cardiac issues, before pursuing intermittent fasting. But I'm a big fan of it, and I recommend it to many of my patients.
And have you guys done studies where you look at someone before and after, when before they've done a fast and after they've done a fast, and look at the brain and see what it looks like post-fast?
That's a great study idea, and maybe you'll be patient number 1 in our study.
Cool. I'd be happy to. I need to get over to the States though.
Yeah.
And I've seen that there's quite a bit of research also on like hot and cold, on saunas and ice baths and things.
Yes.
What have you seen on the temperature side, hot and cold? What are the benefits?
The benefit is toxin elimination. So for a cold plunge, what's really happening? You're diving into really, really cold water for 5-10 minutes, however long you can tolerate. Your body immediately tenses up every muscle group. And what that does is it milks the lymphatic drainage system. And so it helps get all the schmutz that accumulates in our body and get rid of it. And in addition, there's some immunity benefits because it mobilizes white blood cells, and actually increases dopamine too, So there are some people
that I can attest to.
Yeah, there are some people who do a cold plunge first thing in the morning, and they're having a very focused morning, and then sauna, infrared or traditional steam sauna, again, is really, really helpful for toxin elimination, primarily through sweat,
And I mean, I've seen that there's some research also on saunas, particularly for things like Alzheimer's and things to help prevent that. I don't know how accurate that data is, but
well, I think it could be a very helpful intervention because, again, one of those bright minds risk factors was toxins, and anything we're doing to help give our brain a little bit of a break from the toxins it's trying to process or that it's being exposed to, I think is useful.
I do a cold shower every morning for 2 minutes, which it's really cold, especially here in the winter when it's snowing outside. And I do, when I'm in South Africa, I've got a top loading freezer which I get in.
Oh, that's great.
People think that they think you're a little bit nuts, but the feeling
don't judge until you've tried it. Don't judge until you've tried it.
For people that haven't done it, the feeling is incredible when you get out, and maybe that's your body's sort of being thankful that it hasn't died of hypothermia. But you feel like you
in gratitude practice very quickly.
Yeah. For those, I mean, I don't know what your protocol is or what you do, but what would you sort of recommend for people in terms of hot and cold as an ideal sort of practice?
I think doing it maybe 2-3 times a week. For cold plunge, you're wanting to get that water pretty cold, often 59, 60 degrees Celsius, something along those lines. Not Celsius, Fahrenheit.
Fahrenheit.
Yeah, you're not wanting to boil yourself. And usually that might be, again, like 5-10 minutes, depending on what someone can tolerate. And for sauna, again, a couple times a week could be useful. And maybe something like 15 minutes or so. Obviously stay very well hydrated and make sure you're not getting faint when you're in there.
Yeah, people have a tendency to want to overdo things. Like if it's good for you, then more must be better.
Yeah. Well, anything in excess is a poison, even water, right? So you can die from drinking too much water. So
I think that's
key.
That's another thing with the whole technology and social media that is having a big effect on our mental health, is the sort of misinformation out there. And there's so much information on this is good for you, that's good, you should eat this, don't eat that, don't drink this, you should get in a cold plunge, you should do that. And I think it's incredibly hard for people to know what the heck to do because, everything, every video you watch, there's so much.
And you can see, yeah, exactly. You can see two different people say two different things. So number one, I would say, when you see someone post something, the amount of time you dedicate to watching the post, you should dedicate twice as much time to checking the source. Like, who is this person? What are they saying? What's their background? All that. The second is, don't take on 15 things at once, because you won't even know what's helping you if you embark on starting 5 different interventions at the same time. Just add one thing at a time, see how you feel. Is it improving things? Great. Is it not? Move on to something else.
And maybe that's a good way to sort of move into this sort of. I like to the last couple of questions. The one thing I like to always add is some practical advice for people. If you could give a sort of shotgun approach for people for the basics, if they want to just improve their health and performance brain wise and their focus, what would you suggest? Is the sort of easiest steps that they could do today to do that?
5 things. Number 1, don't believe every stupid thought that you have.
Mm-hmm.
Our brain floods us with automatic negative thoughts, and it really can affect how we view ourselves and how we view the world. So anytime we have an automatic negative thought, it's important to call it out and ask, is it true? Is it 100% true? Is there a more accurate thought? This isn't about rosy thinking, right? It's just, is there a more accurate thought? And what would that thought be? And how do I feel with that new thought? Okay, so don't believe every stupid thought that you have. Exercise. Try to get at least 20 minutes of cardio 4 days a week, and then ideally build from there. Eat right. Don't put trash into your body. Anytime you have food in front of you, ask yourself, is this good for my brain or bad for my brain? Just take the second to ask it, and that'll build awareness. Protect your sleep at all costs. Sleep is critical. It's not passive. It's an active thing for your brain. And then connect with your community. Make sure that you have meaningful relationships in your life. And if there are relationships that aren't meaningful or weigh you down, plants grow better when they're pruned.
I think that's one that often does get overlooked, is the relationship side, because I see people often, I hear people say that, this person, they were healthy and they got sick and, they got cancer or they got this and they were eating right and they were exercising. But, there's, as you said, there's so many different factors that are, that health is compromised, is compiled of so many different factors. So if you could do one of them right or 2 of them right, but if you're doing the rest wrong, then it's, you could still be in a bad spot.
Exactly. If you're a marathon runner who's also smoking a pack of cigarettes a day, it's probably hard to be a marathon runner doing that. But, or if you're someone who's biohacking, but then, you have 4 alcoholic beverages a night, well, again, it's ask yourself before anything you do, is this good for my brain or bad for my brain? And try to make more good decisions.
That's actually, something that we didn't touch on is alcohol, but I'm assuming it's is there a sort of a safe amount, or is it any alcohol is bad?
Yeah, so it's a big question. Alcohol is ethanol. There's no safe amount of ethanol for the brain, right? But even 1 drink has neurotoxic effects. The difference is when we have 1 drink here or there, our brain has a chance to recover. When we're having multiple drinks every single day, our brain does not have the chance to recover, nor does our liver. There's data that shows that even 2 to 3 drinks a day for men can lead to fibrosis of the liver over time.
Crazy.
And if it's doing that, then what is it doing to the brain? That being said, I myself will have an occasional glass of wine, maybe for a special event, or, maybe something like once every couple months, once a month, something like that. So, because there's also the social piece, there's also the stress reduction piece, there's also the taste, the enjoyment that comes with it. And assuming someone isn't having alcohol addiction, I think know that the best amount for your brain is 0, but if there's a little bit here and there and it's enhancing other areas of your life, social connection, relaxation, I think there are worse things.
No, I think the power of marketing and propaganda is just incredible, when it comes down to alcohol, because, I don't drink, and I used to drink a bit more when I was younger, or when I just finished school, obviously in that stage of your life, going out and partying with friends and stuff. But I just felt that I always, you don't feel good afterwards, even if it wasn't a really bad hangover. But, you just, especially when it comes down to doing sport and stuff, which obviously I'm with my sport, I would just feel for a couple of days afterwards, I would just feel flat. My energy wasn't there,
Absolutely.
and
Yes.
my sleep wasn't great. And,
Yep.
I just kind of got to the point that I started drinking less and less over the last sort of 10 years or so. And I kind of got to the point where I was like, you know what? It's not, for me personally, it's not worth it. Like the downside outweighs the pro for me. But it's crazy because when I go out now and I order a glass of water or something non-alcoholic, generally it's not sugary, and people look at me like, and they say, "Oh, why are you not drinking?" And
Yeah.
and then you say, "Oh, I don't drink," and then they think one of two things: either they think you've been an alcoholic,
Yes.
or they think you're weird. Like they think this. They're like,
It's
why? They
the
can't
and it's the
understand.
only drug. It's the only drug where it's like that, right? If someone, if you were in a place where everyone was doing cocaine and you just said, "No, thank you," people wouldn't look at you weird, They'd be like, "Okay, yeah, this guy doesn't do cocaine." But somehow alcohol has
It's
a very different view in society, even though it's a drug. It's a drug, right? And it has neurotoxic effects and it ages the brain. And there's all kinds of, outside of the brain, there's all kinds of other organ involvement. And yet, as a society, you're right. It's like, oh, you're not drinking. What's wrong with you? Are you okay? Is everything okay? Well,
yeah.
go and have a drink. And I've had patients who have struggled with alcoholism and have become sober and will be at social events and they're almost feeling pressured to drink. Like, are you sure you don't want to have a drink? Come on, have a drink. We're all having a drink, And I think the more we talk about this kind of stuff, the better we can sort of shape how society is actually viewing alcohol. So let's keep talking about it.
It's what's also interesting is that the crazy part I find is if you told someone that you're not drinking alcohol, they think it's weird. But if you went and told that same group of people, no, I don't drink water. I drink juice, I drink alcohol, I drink coffee, but I'm just not into water. They probably wouldn't give it a second look. They'd be like, okay,
Yeah,
because
this guy doesn't like water. Yeah, exactly.
yeah, like I know so many people that tell me they don't like water, they don't drink water. And it's just so backwards. It's crazy. Like,
You're totally right. You're totally right. I've noticed the same thing.
oh man. Okay. The final question, which I ask every guest, is what does success, the word success, mean to you?
I think the word success to me means living aligned with whatever your purpose is. So an exercise I like to have people do and that I do is rank the top 10 priorities in your life, 1 to 10, and be honest about it. This is just for you. It's not for anyone else. So your priorities are your priorities, but rank them 1 to 10. And then on a separate list, rank 1 to 10, how much time you're spending on each of those priorities, and look for discrepancies. If there are discrepancies, like something's really important to you, but you don't spend a lot of time on it, or vice versa, correct it, realign how you dedicate your time. And that's living a life aligned with purpose, and that's success.
That'll do it. Dr. Storage, this was a pleasure. Thanks so much for coming on.
I'm so glad we could connect. It was great meeting you. Great chatting. A lot of important stuff we talked about.
If you guys enjoyed this episode, please like and subscribe. And to see more episodes, click the link right up here.
That was iconic.